Hi, I'm David King-Lassman. This is Explore XR. And today I'm thrilled to be joined by Dr. Mark Cohen from the University of Michigan, Michigan Hospital. Mark, lovely to have you. Why don't we kick off by telling our viewers and listeners a little bit about you, your journey, what you've done, how you've got to where you are today.
Sure. Well, first, thanks for having me, David. It's really a pleasure to be here today. So my name is Mark Cohen. I'm a professor of surgery, biomedical engineering, and pharmacology here at the University of Michigan. I had my start in the wonderful city of St. Louis, where I went to engineering school at the Washington University in St. Louis, and then medical school, followed by residency in surgery at Barnes-Jewish Hospital there in St. Louis. And I've always been interested in the intersection of technology and medicine. That's kind of how I started in engineering and continued to a very technical field of medicine, of surgery. But at the same time, going through 16 years of education and training to get to a point where I can practice on my own, you learn a lot of things along the way, but you also, over the last 20 years that I've been doing surgery, I would say that the field has evolved at an astronomical rate. And the things that we can do today were not things that were even thought about when I was in training. The amount of technology that's been incorporated into medicine and into the operating rooms and into the places where we interact with patients is just continuing to grow. And to be facile in that interface is even more relevant now than it ever was, not just to people like me, but to our younger trainees who are coming up through the system and are trying to learn how to be good doctors and how to be best advocates for their patients. And so my interest peaked in the last few years, specifically around ways that we can better engage technology in medicine, but also how can we innovate more effectively to solve problems that we currently have? How can we educate better? How can we think about clinical care delivery and research and simulation better? Mm-hmm. And so that's been a journey, and it's been a wonderful journey. And I've been very fortunate to have great colleagues and folks I've worked with along the way. And at the University of Michigan, when I came here in 2012, I've really seen an evolution in that mindset around innovation and how it can be applied into medicine, and building programs and curriculum for medical students, for faculty, for residents has really been a passion of mine and something that's been really rewarding. And as you think about those type of things, David, I think the key things that I've been so impressed by is being, not just that there's so many technologies that are coming through the pipeline, but being mindful of what are the best solutions that really can empower physicians and that experience they have with their patients to be better and to be to bring about a product at the end of the day that's going to be a much higher level of skill and a much better way to integrate. So I think that as we evaluate new technologies, we're always excited to find opportunities to really enhance education, enhance clinical care delivery, and really advance medicine. And that's been really something that's been something that I've been extremely interested in and kind of led to how you and I got to meet. So
Right. And it's kind of interesting, isn't it? In medical fields like yours, you spend an enormous amount of time learning your craft, 16 years, I think you said. And then, of course, the learning never really stops, right? Technology is moving so rapidly, both, technologies like ours, but also the technology that's around you in the hospitals, is surgery and so on. I guess a doctor never stops learning, right?
I think that's super important. And I think, the advances in medicine are exponentially growing, and the amount of knowledge that encompasses how we learn about diseases, how we learn about treatments, what options we have for patients now are better than they ever were in the past. And to be relevant and to be the best advocate for your patients, it's important for clinicians to really know what's the best options out there to consider, but also how to evaluate new technologies that they can incorporate into their practice in a way that's going to help their patients. And so, when we think about that there's always learning that has to happen. I mean, as a surgeon, laparoscopic surgery was just starting when I was in training. Now it's the most common thing that a lot of surgeons do. There's robotic surgery, there's minimally invasive techniques that we never thought possible before. Instruments are getting smaller, more facile to use. So you have to stay relevant and learn new things. And so how do we learn and how do we, maintain that skill set is super important to be the best advocates for our patients.
Right. And there's an interesting relationship between, say, the Hippocratic Oath that you take when you become a doctor to think about the welfare of your patients, making sure patient outcomes are as successful as possible, but also particularly in the society we live, there must be enormous pressure on hospitals to minimize mistakes, because we're in a litigious society, and presumably every hospital has to deal with the fact that when things go wrong, it can be very, very costly. What we're hearing is that some of the technological advancement is actually really improving patient outcomes and therefore reducing some of that liability that hospitals are exposed to. Do you think that that's true where you are at Michigan?
I think all health systems want to optimize outcomes and lower costs and create the best ways for patients to have care delivered in their system. And we at Michigan are very interested in tracking how we can improve our outcomes, our efficiencies, our training processes to really create the best environment for patients. And I think that's something that we look very closely at. And then when we evaluate new technologies, that's a very important lens that we look at is it something that's actually going to improve some of those outcomes or some of that process, both on the education side or on the clinical care side.
Okay. So people will know now that University of Michigan and GigXR have a very tight strategic relationship. We've been working with you for some time, and we're very excited about the applications that we're developing that should be on our platform in 2022. Looking back, we've known you for some months. What brought you to us? What did you see in mixed reality that you felt was going to be something that could make an impact, a positive impact in your field?
Sure. I think that, as we look at technologies that allow this kind of mixed reality component to be involved in medical thinking, and whether it's education, clinical care, you have to think also about what added value does it bring to the clinician or the provider or the patient. And what are the gaps in our current models and systems that we're trying to solve? So one of the principles that they teach you in engineering school is find the right problem to solve and then develop the right solution for it. And then you're going to be in a much better position than if you just make something and try and find a problem to put it to. So thinking really critically about some of the problems and gaps we have in our education and simulation processes, how, especially in the last couple of years when virtual education became the norm for a lot of students. Instead of medical students being at the bedside on a regular basis, they're now learning from their laptops and their apartments in quarantine, or they're are told to keep away from certain wards of the hospital due to high infection risks and things. So we had to learn how to adapt education to meet the needs of the learner without losing the value of what we're trying to deliver content-wise. And so when you think about what are these gaps and what are these opportunities, mixed reality really has a role, I think, in filling some of those needs and also augmenting that process in a way that really immerses the learner back to the bedside in a way that allows them to maintain that educational value of patient-based care.
So That's a terrific answer. Thank you. Virtual reality has been around for some time, and I know you're technically highly proficient. I'm sure you've seen many virtual reality applications. Of course, one of the great benefits of mixed reality, whether it's using a device like the HoloLens or engaging with phones, is that you're taking people out of that fully digital paradigm, that immersed world. Can you talk a little bit about the benefits that you think will come from having a cohort of students being able to work together around holographic content?
Oh, absolutely. So I think one of the real benefits of mixed reality that's unique compared to virtual reality is that mixed reality allows you to incorporate real life things into your visual field and augment it with things that can help you in that thought process. So for example, you still can interact with a patient like you normally would, but now you can pull in holographic assets of their imaging and their labs and their models of their disease to both educate the patient, educate learners with you, but also help with some complex decision making. By having these tools, you can bring in people from around the world, right, to connect with you in real time at the bedside, where you can have discussions of complex cases and really break down barriers of time and distance and bring people that are needed to help in a multidisciplinary format right there at the bedside without crowding a room, without needing all the protective equipment for infection, but in a way that can be helpful to patient care. And the thought around that with simulation and education is equally exciting, because now you can bring multiple learners into an environment to have them interacting together and working with real patients as well as patients that have been created in augmented ways to allow you to see different disease sites, to change the situation and really look at different scenarios so that the learner can experience a lot of different opportunities, all while being at home or in an environment where they can learn in a more effective way. And one of the things that's really exciting with mixed reality is you can add elements to the situation that really enhance the learning experience. And so that's one of the things that's exciting about working with GigXR, is that your platform for developing these mixed reality assets that help with the standardized patients or virtual patients, as well as the anatomy and the ability to overlay anatomy onto an area where you can actually see things like how diseases manifest or make interventions or things to a mannequin or a virtual image that really allow the learner to understand that disease more effectively, but more importantly, develop some skills around how to take care of that or do a procedure before they actually have to do it on a real patient.
Yeah, that's super interesting. I think what was fascinating about our journey, certainly when I started this business, I thought that it would be pretty much an ed tech play almost, rather more than a health care play, that we would be training people using holographic content in certain tasks. And I think what's been really fascinating in our journey is that it's opened up this huge opportunity for not just retraining, but also allowing people to connect and communicate with one another in really dynamic ways. Can you think about mixed reality, how it's going to really apply positively in a hospital environment among qualified doctors who've been through all the training? How do you think it's going to benefit the hospital on a day-to-day basis?
So I think there's a lot of potential use cases for mixed reality in the hospital environment. One of the things that is a very important skill, whether you're a first-year resident or a senior professor, is not only how to handle situations with patients, but how to handle team training exercises around different things. And there are a lot of soft skills that can be learned through mixed reality too, such as dealing with patients that have a disruptive patient or a disruptive provider, or something where you have to think about how that team training and interaction of members of a team are around a particular situation. There's opportunities to think about ways to implement this for when we think about transitioning patients out of the hospital setting to a home or a rehabilitation environment. How do we maintain that expert level interaction at the bedside? And these type of tools can really provide us with that connectivity that lets our providers and our specialists really maintain that continuity of care and that specialized therapy that's needed for patients as we transition them from the hospital to the home. And of course, when you think about resource utilization and cost, anything you can do to improve both of those areas is going to be helpful, not just for the health systems, but also for the state and the economy as well. So I think ways that we can work smarter and think about better opportunities to interact with patient care is going to be useful. And in the hospital, I think we do a lot of team training things, whether it's how to respond to a fire, how to evaluate a patient that's in distress on the wards. There are trauma situations where you have multiple team members that need to all be doing different tasks. So how we can create those environments with mixed reality to allow people to engage with them, immerse in them, and really interact with each other in real time. Those are invaluable opportunities to develop skills and enhance skill sets that may already be there.
Right. And of course, we've already seen this in the work that we're doing together, that we can build incredible hyper-realistic content. That must make a big difference in the efficacy of this kind of training if you compare it to, say, some of the high-fidelity mannequins that you use that are pretty static, right?
Yeah, and one of the things that is to me exciting about our project is, with the ability to use mixed reality, you can change the scenario to a number of different situations. So you can change gender, you can change size of the patient, age of the patient, you can change some of the anatomy. You can look at how we deal with complications of procedures, not just the procedure itself. And those are things that a static mannequin may not be able to provide to the learner. And so having this enriched environment really lets the learner experience things in a more realistic or life in a way that they would see it in the clinic in real life.
Right. Yeah. It's funny. We heard a lovely anecdotal story here in LA of standardized patients coming into teaching hospitals dressed up as a diabetic, and it's a 22-year-old actress who's svelte and gorgeous, and it's just sometimes not the way it really is, right? So this is offering so much more opportunity to get a sort of more rounded experience to what patients look like, how symptoms are exhibited, and so on.
Oh, absolutely. And I think from the learner's perspective, I think the first step is learning the skills. The second step is learning how to deal with potential problems with those procedures, and then how that can be applied to a number of different anatomies, a number of different shapes and sizes, and complicated patients. I think that simulation environment really enhances their skills, not only to adapt and be able to handle things more effectively, but also to consider, that when they hit a real world situation, they know how to, they understand kind of all of the nuances that are really the important part of those skill set development.
Right, and they'll learn presumably more effectively how to respond when things go well, but also importantly, what to do when things go wrong, right? Sometimes it's hard to teach that with some of the analog technologies that are around, but presumably every trained doctor has to be ready to respond when something goes wrong on the operating table.
Yeah, and I think in terms of complications are something that will never be zero, but the problem is how soon you recognize a complication and how well you can deal with it early on before it progresses can have a big impact on how the outcome may go. And so being able to recognize these complications during procedures more effectively and deal with them allows the learner to be able to then translate that if they encounter those complications in the real world. So I think that type of experience is something that's been hard to teach in the past, and now is something that's going to be exciting to learn how that can really improve outcomes and impact.
So you're making a fairly sizable investment in mixed reality in a number of ways, not least in the work that we're doing together. So you're already converted, you're an enthusiast. If you could sort of look ahead here, Mark, and think about how mixed reality is going to transform the healthcare sector and what things are going to look like down the line, you know, what do you see the future to be here?
Yeah, I mean, I always think about, like, if I had a crystal ball and what I would probably make some different investments, but no, I think that the key thing is, you know, with mixed reality, and I think innovation in medicine in general, in terms of the future, I think that we are going to transform a lot of how and where care is delivered into a way that's very fluid and mobile, and breaks down a lot more barriers than we currently have. So when you think about mixed reality and its applications, not just in simulation, but in clinical care delivery, and this whole concept of bringing experts to the bedside wherever they are in the world, you know, you can imagine doing things like telesurgery in another country where an expert can walk another surgeon through that procedure 1,000 miles away just by sharing the same vision and what's happening in the operating room. There's ways that we can think about point of care delivery. So imagine when the emergency medical team come to your house for an emergency, if someone's wearing one of these headsets, they're directly connected with an ER doctor who can kind of guide them through those critical steps right at the first point of contact that may make the difference between making it to the hospital or not. And so you can think about how this expansion could really impact clinical care delivery in a number of different ways. I think, you know, as we evaluate all of these technologies and think about these wonderful use cases, one of our important areas that we think is super critical to these as well is also understanding their current limitations and where we can innovate further and develop things that really will meet the needs of the future, as well as provide the best outcomes and the best models to use for our patients and our learners.
Well, I think that's a beautiful point at which to probably leave things here with that fantastic vision. You know, I'm so thrilled that we're working with you guys. You are visionaries at Michigan, and I'm thoroughly looking forward to continuing the relationship and seeing the fruits of our labors when they come to market in 2022. Dr. Mark Cohen, you've been a star. Thank you so much. I'm David King-Lassman. This is GigXR.